I'm Dr. Joe Norris of McLean County Orthopedics in Bloomington. One of the most common presentations to my office for evaluation is shoulder pain. Often patients come questioning whether or not they have impingement syndrome, which they may or may not have seen on the internet or heard from a friend. Impingement syndrome is really a more complicated term for rotator cuff tendinitis and bursitis. The presentation will often be pain on the outside of the shoulder with overhead activities or maybe reaching behind yourself in the car or for a belt. The causes of impingement syndrome are two anatomical structures physically impinging on one another. There is some academic debate about whether or not they actually touch one another, but the premise stays the same. The ball, as it moves away from the socket, can hit the roof of the shoulder or the acromion and pinch or impinge all the structures between those two structures, namely the rotator cuff tendon and the bursa that lies between the ball of the ball and socket and the roof or the acromion. With repetitive overhead activities, the bursa and the rotator cuff getting pinched or impinged upon can lead to inflammation. This is different from a full rotator cuff tendon tear, but they often present similarly if the patient has full function but just pain and disability. An orthopedic provider can discern between the difference of a full thickness rotator cuff tendon tear and pure impingement syndrome. The treatments are usually non-operative and don't require surgery. They can start with as simple as an injection or medicine by mouth and a short course of physical therapy for an instruction on a home exercise program that you can complete on your own. No matter what, it's important to know that you don't have to live with shoulder pain. An orthopedic provider can provide not just the diagnosis, but a likely solution to your problem.